Hey there, fellow knowledge seeker.
Uh,
You really went all out this time, huh? This stack you gave us is huge. Aging, health, finances, really the whole 9 yards.
it's pretty comprehensive, yeah.
But it definitely seems like you're on this quest not to just, get older, but to get better with age. You know what I mean?
That's the goal, isn't it?
I like your style.
And your sources really do a good job of showing how to do just that.
Yeah.
They cover pretty much everything.
Okay, like what specifically?
Well, we've got the health hiccups that, kind of pop up along the way,
Mhm.
the financial side of retirement, and even, those mental and social shifts that sort of come with this chapter of life.
True, it does feel like that stuff kind of just creeps up on you.
Commit.
One minute you're like, I don't know, some friend's 30th birthday party rocking out. The next year you're like frantically whispering questions to Google about Roth IRAs
Yeah.
and willing your knees to please cooperate on a simple staircase.
I think we've all been there.
Oh, for sure.
But what's interesting is
Right.
these sources, they don't shy away from the challenges,
Yeah.
but they also highlight the amazing, the really incredible opportunities that come with getting older.
Okay, cool.
It's definitely not all downhill after you blow out the candles on that 50th birthday cake.
So you're saying there's hope for us.
Oh, absolutely. Not even close to all downhill.
Okay, so let's dive in. Where do we start?
Well, I think a good place to start is this whole longevity bonus thing.
Oh, yeah, I've been seeing that everywhere.
It's true. People are living longer than ever.
Like how much longer?
The CDC data says almost 2 more decades after 65.
Wait, whoa, that's what? An extra almost 20 years?
It's a whole bonus round of life.
That's wild.
But, with those extra laps around the sun, often comes a higher likelihood of having to manage chronic health conditions.
Oh, right. Like what
Well,
what kind of things?
things like heart disease, which is still the leading cause of death for those 65 and older.
Yeah, that makes sense.
Almost 500,000 deaths in 2014 alone.
Wow.
And that trend, unfortunately, has not gone away.
So, how do we balance that out? Longer life, but also heart health.
That's where I think the choices we make in our daily lives get really, really interesting.
How so?
Well, you see, I think we often think of heart disease as this, inevitable consequence of aging, right?
Right, yeah.
But I was reading one of your sources, Dr. Bernard.
Right.
You put it perfectly.
How?
He said, it's all about those small daily choices. Those small choices that add up.
Like what?
Exercise, balanced diet, sleep.
Okay, yeah.
They sound really simple,
They do.
but the impact over time is huge.
Huge.
Yeah.
Like, okay, I feel like it's really easy, though, to let those, healthy habits kind of fall by the wayside when we're busy with work and family and all that.
It's hard.
Yeah.
Yeah.
So, speaking of things that can really sneak up on you, what about Alzheimer's? I noticed these sources went pretty deep on Alzheimer's
They did.
and its impact, which it sounds like goes way beyond memory loss, right?
Right, it does.
Like how so?
Well, I think it's really easy to focus on the memory aspect of it, for sure.
Yeah.
But the ripple effect, it really does touch so many other parts of life.
I see. Like what?
Personal safety, your ability to handle daily tasks, even finances.
Really?
Because the cost of caregiving, that can be significant.
I bet.
Yeah.
How much are we talking about?
Well, the Alzheimer's Association estimates that over 11% of people over 65 have Alzheimer's.
Wow.
Yeah, that's a lot.
That is a lot. So, that's a good reminder to,
Yeah.
talk to your family and loved ones about cognitive health.
Absolutely.
It sounds like early detection can make a big difference.
It does. It really does.
Oh, okay. So,
Actually, on that note of being proactive about health,
okay.
I was surprised how much these sources focused on oral health.
Oh, yeah.
We don't always think about that.
No, I know, right? Yeah. Like when you think about aging, you don't really think about your teeth.
No, but it's not just about having, a sparkling smile for the grandkids.
Exactly.
It's really fascinating, the connection between oral health and just overall wellness.
So what kind of connections are we talking about here?
Well, as we age, our mouths naturally get drier,
Yeah.
which can increase your risk of getting cavities.
Makes sense?
And then you've got the link between gum disease and systemic issues,
Systemic issues. Okay.
like heart disease and diabetes.
Wow, I had no idea.
Yeah, it's really interesting.
It is interesting.
And,
Oh,
this just blew my mind.
okay.
A quarter of adults over 65 have no natural teeth left.
You're kidding.
I know.
That's crazy.
It's wild, right?
Yeah, it really is. Wow.
So it's fantastic that we're living longer.
It is fantastic.
But it's pretty clear that, being proactive about our health,
Yeah,
if we want to enjoy those extra years,
right, exactly.
it's key.
It is key. And speaking of enjoying those years,
Yeah.
what about the financial side of like getting older? I feel like that's where, I don't know, it's just me, but I get that like deer in the headlights look.
Oh, yeah.
Everything else, okay, I can deal with. But the finances,
It's understandable.
it is.
It can feel like this like big tangled web, retirement, finances,
Great.
all these terms and deadlines.
Right, exactly.
But it doesn't have to be overwhelming.
Okay, that's good.
We just need to, break it down a little bit.
Okay, I like the sound of that. How do we do that?
Let's start with the big one, Social Security.
Okay,
It's actually more complex than I think a lot of people realize.
really?
You see, the amount you get, it's not just a set number, it's affected by like when you start taking it,
Oh, okay.
your work history,
Oh, interesting.
even if you're claiming spousal benefits.
See, that's what I'm talking about. That sounds like something you need like a decoder ring for.
It can be confusing.
It can be, for sure. And I mean, like on top of that, it's not even just about like understanding how it works.
Right.
It's also like, is it even enough to live on?
That's the big question, right?
Because like there was this Kaiser Family Foundation report. It was from 2013,
Okay.
and it was saying that almost half of adults 65 and older were living below the poverty line.
That's a lot of people.
It is a lot of people.
Yeah.
And it just makes you wonder, like, how does that even happen when we have Social Security?
Well, it's not just one thing.
Right. I figured.
It's a few different things all happening at the same time.
Okay, like what?
Well, sometimes Social Security is just not enough.
To cover all of your expenses.
Right.
Yeah, that makes sense.
Especially with how much healthcare costs are going up.
Oh, for sure.
And then you add in the fact that
Right.
a lot of people just aren't aware of the full picture
What do you mean?
when it comes to retirement finances.
Oh, okay.
Like they might be relying only on Social Security and not realizing that, Medicare, which is great and helpful,
Yeah, of course.
but it doesn't cover all your medical expenses.
So then what?
Well, that's where options like Medigap and Medicare Advantage come in.
Medigap, Medicare Advantage. Okay.
Yeah, have you heard of those before?
I've heard of them, but honestly, I don't really know what they are.
Okay, so
At
basically...
least explain it to me like I'm 5, because this is a lot.
Okay, so Medigap basically acts like a safety net,
Okay.
and it covers some of those gaps that traditional Medicare, leaves open.
Oh, okay. That makes sense.
And then there's Medicare Advantage, which is run by like private insurance companies.
Okay.
And a lot of times it comes with like additional perks,
Oh, okay.
but it can also have different costs and restrictions. So
So it's like a trade-off.
it can be, yeah.
Wow. So it really is kind of like learning a whole new language just to like figure out your healthcare options.
It really is a lot to figure out.
And we haven't even like touched on the cost of long-term care,
Oh, right.
which I imagine is, I don't even know, probably a lot.
Yeah, you're right. That's often like the elephant in the room, when we're talking about retirement.
Nobody wants to think about it, right?
Right. Nobody wants to imagine that they'll need it.
Of course.
But, the reality is that a good amount of us will need it.
Oh, okay.
And the costs,
Yeah.
they can be pretty staggering, honestly.
Like how much are we talking here?
Well, it can reach 6 figures, depending on, what type of care you need and how long you need it.
6 figures. That's insane.
It can be really, really pricey.
And how long on average are we talking about needing that care?
That's where it gets even more interesting.
How so?
Well, it actually differs between men and women.
It does.
Now, on average, men need it for about 2.2 years.
Okay.
But for women, it jumps to 3.7 years.
Wow. That's a huge difference.
Yeah.
Wow. And I'm sure that plays into the costs too if it's that much longer.
Oh, absolutely.
Jeez. No wonder people get anxious thinking about long-term care.
Right. It's a lot to process.
It is a lot.
Yeah.
So, okay, how do you even start to, I don't know, wrap your head around planning for that and not feel like totally overwhelmed by all of it?
Right. So there are a few things you can do.
Okay.
One option is to just, pad your retirement savings with a good cushion.
Okay, so just like save more money.
Yeah, basically just make sure you have extra set aside specifically for potential long-term care costs.
Okay, that makes sense.
What else? The other option is long-term care insurance,
Oh, right. I've heard of that.
which can help offset some of the costs if you do end up needing care.
Okay.
Have you ever looked into that at all?
I haven't, but I've heard like mixed things about it.
Yeah, it really depends on who you ask.
Some people say it's like essential and others are like, don't even bother. It's a waste of money.
It's definitely not one size fits all.
Right.
It comes down to your own, personal circumstances,
Okay.
your risk tolerance,
Okay.
and just your overall financial situation.
I see.
So it can be helpful to talk to a financial advisor.
Oh, okay. Like to help you decide what's best for you.
Exactly. They can help you figure out if it's the right move for your specific situation.
Got it.
Yeah.
It's kind of like you're trying to plan for this future that, like, who even knows what it looks like, right?
Yeah, that's the tricky part.
There's so many what ifs when you're talking about stuff like long-term care.
All right.
But anyway, I wanted to shift gears a little bit because we
Yeah.
talked a lot about, the financial stuff and
Yeah.
the physical health stuff.
Uh-huh.
But these sources also, like, they go deep on the mental and social changes that happen as we get older, too.
Absolutely.
And that's really important.
It is, and it kind of goes back to this whole thing about taking control, you know?
Yeah, exactly.
Like retirement, it can be this time of, incredible freedom. We have all this time to do whatever we want.
Right. You'd think it'd be easy.
But then it's also easy to just fall into this rut.
It is. It is.
If we don't actually have a plan for how to stay mentally and socially active and engaged, you've got to be intentional about it.
Yeah, because it's like that saying,
What's that?
retirement. It's not about having time to do the things you've always wanted to do.
Yeah.
It's about having the will to actually do those things now that you have the time.
Oh, I like that.
Right.
That's good. Yeah.
But seriously, though, like, what happens when that, initial, I don't know, excitement of being retired wears off?
That's the real test.
Right. And then you're just kind of, faced with this, blank slate every day.
It can be tough. And, one of the things these sources talk about,
Yeah.
what I found really surprising was this link between early retirement
Okay.
and cognitive decline.
Wait, really?
Yeah.
So you're telling me, retiring early could actually make my brain, I don't know, less good?
Well, it's not quite that simple, but essentially, yeah.
I mean, that just seems so backwards.
It does, doesn't it?
Because I feel like less stress, right? That
Yeah.
should be good for your brain.
You would think so, yeah.
Right.
But, it turns out that, staying mentally and socially stimulated, it's like exercise for our brains.
Really?
Yeah, it's what keeps those neural pathways, firing
Okay.
and helps, ward off cognitive decline.
So wait, what you're saying is it's not enough to just, do Sudoku puzzles all day.
No, it's much more than that.
Right.
And the good news is
What?
it doesn't have to be, complicated brain games or anything like that.
Okay.
Simple things can make a big difference.
Like what?
Engaging in hobbies,
Okay.
nurturing your social connections,
Uh-huh.
learning new things.
Okay.
Those can all help a lot.
Gotcha. So instead of thinking about retirement as, this endless vacation where I just lay by the pool and read books,
Right.
it's more about finding new things to be passionate about,
Absolutely.
to keep my brain, doing its thing,
Exactly.
working out.
Yeah, it makes sense if you think about it.
How so?
Well, for most of our lives, work is this built-in structure.
Right.
You've got your social interaction from work, you've got problem solving,
Yeah.
even just the act of getting dressed and showing up every day.
Okay.
But then retirement happens and it kind of disrupts all of that.
It throws it all out of whack.
Exactly.
So we have to, figure out how to build a new routine.
Yeah, and that's where it gets, more personal.
Right, because everybody's routine is going to look a little bit different.
For sure. So it's more about asking yourself, what brings me joy? What skills have I always wanted to learn? Or what skills do I already have that I want to, dust off and use again?
It's almost like you're designing your ideal life, but this time around,
Yeah.
you get to just, prioritize what really matters to you.
Exactly. Yeah.
And I did notice that the Cleveland Clinic talked about this.
Oh, yeah. What do they say?
They were saying how important it is to stay socially active.
That's huge.
And they suggested, a bunch of different things. Finding hobbies, joining groups,
Sure.
traveling, even just, volunteering.
Yeah. All great ways to stay connected.
Right, exactly. Combat loneliness. you
Yeah.
know?
Keep those social muscles flexed.
Yeah, exactly. And speaking of things that are, really good for the soul,
Oh, yeah.
let's not forget about our furry friends.
Our pets.
Yes, the pets. There was this whole thing about how spending time with a dog can lower your blood pressure.
Oh, yeah.
Isn't that wild?
That's amazing.
Who needs
Yeah.
medication when you can have cuddles from, a canine?
Right, exactly.
So cute.
It's incredible, pets offer that companionship and that unconditional love,
Yeah.
which is so beneficial, especially as we age.
Yeah, it's true. It's true. But I did want to go back for a second because
What's up?
we were talking about, the things we can do
Yeah.
and how we design our lives, right?
Right.
And, beyond just, our social groups and, spending time with our pets.
Yeah.
These sources also talked about this idea of like easy access in retirement.
Oh, easy access. Okay.
Yeah, and at first I was like, what are they talking about?
Yep.
What does that even mean?
Right. Like having easy access to what?
Exactly.
But then they explained it, and it was really interesting.
What'd they say?
Basically, it's this idea that, like, as we get older, our priorities kind of change,
Okay.
and things that we didn't think about before
Right.
suddenly become really important.
Like what kind of things?
Like walkability.
Okay.
Whether or not I can, walk to the places I need to go.
Makes sense.
How close are those things to my like amenities and services, right?
Yeah, yeah.
Even like the layout of our homes,
Interesting.
it all starts to matter.
I guess we start to think about like,
I know, right? Like, it's almost like you're thinking ahead to a time when, I don't know, maybe you can't get around as easily as you used to.
right, like your mobility might be different.
Exactly. And you want to be in an environment that, works with those changes, not against them.
For sure. It's about being proactive.
It is. It's about setting yourself up for success.
Exactly.
In that next chapter, right? Yeah, so it's less about, like, having this fancy house
Yeah.
and more about, like, is this a functional house? Is this a supportive home environment?
Exactly. And Forbes Health actually had some really great advice about this too.
Oh, they did. What did they say?
They were saying, to think about things like, is your neighborhood walkable?
Okay.
How's the lighting around your house?
Oh, yeah. That's important, especially at night.
Exactly.
Yeah.
And like how close are you to essential services?
Yeah, and to family and friends, too.
Right. It's
Yeah.
about creating a space where you can, age comfortably.
Yeah, and independently.
Exactly. For as long as possible.
That makes sense.
So, okay, we've talked about our physical health,
Right.
finances, our social lives,
Yeah.
keeping our brains active and engaged.
Keeping busy.
Even like the way we design our living spaces.
It's all connected.
It really is. It seems like aging well. It's kind of this multifaceted thing, right?
It really is. There are a lot of different pieces to the puzzle.
But I do feel like there's one piece that we haven't quite talked about yet.
Okay, what's that?
And it feels a little bit, I don't know, like it's hiding in the shadows.
Oh, okay.
Okay.
I'm intrigued. What is it?
Substance abuse.
Oh, yeah.
It's not really something we typically, I feel like, think about with older adults.
Yeah, not really.
But, looking at the data,
yeah.
it's definitely a thing.
It is, and it's a growing concern.
It is, yeah. And I was blown away by this one study that found
What's that?
that, like, 1 in 5
1 in 5.
people over 65
Wow.
have struggled with, like, substance or alcohol abuse.
Wow. That's higher than I would have thought.
I know, right? And it said the most common ones were the ones you'd probably expect, alcohol and tobacco.
Yeah, that makes sense.
It does, but it's still, like, kind of shocking to see those numbers,
I know. It's easy to forget about.
It is.
Yeah.
So, I mean, why do you think it's becoming more, I don't know, common? Is that the right word?
Well, I think it's a few things.
Like what?
Well, like we were saying earlier, retirement is a huge transition.
Yeah, for sure.
It's a time of big life changes.
It is.
And for some people, that can be really, really stressful.
I bet.
And on top of that, a lot of older adults are also grappling with other stuff.
Okay, like what?
Chronic pain,
Yeah.
social isolation, loss of loved ones.
That's a lot.
It is.
Yeah.
And if you add to that, maybe a lifetime of ingrained habits,
Right.
or even just easier access to prescription medication,
Oh, yeah, that's true.
it kind of creates this perfect storm
It does.
for substance abuse.
Right, because it's almost like those emotions and life changes, they need an outlet, right?
Exactly.
And substances, sometimes they seem like an easy escape.
Yeah, but it's obviously not a healthy way to cope.
No, not at all. So it's super important to, be aware of, like, what are the warning signs?
Absolutely.
And to encourage people to talk about this stuff more openly.
Exactly. There should be no shame in getting help if you need it.
Right, whether it's for ourselves or for someone we love.
Exactly.
Yeah, and I think that goes back to what we were saying before about how important it is to have those support systems in place.
Absolutely. You need those people you can talk to.
Especially as we get older,
Yeah, people you can lean on.
who can support us, offer guidance,
Oh, sure.
especially when we're going through those tough times.
Exactly. And not just for the tough times.
Oh, that's true, yeah.
They're there to celebrate with us, too.
Right, for the good times and for helping us, actually pursue those passions we were talking about.
Yes.
Like finding people to travel with or to take that pottery class with.
It's about sharing those experiences.
It is. It really is. It's like they say, it's not the years in your life that count. It's the life in your years.
So true.
And I feel like that's what all these sources are really saying, you know? Like,
Mhm.
aging well, it's about way more than just, like, how old you are.
It really is. And what I find really refreshing about these sources is that they don't try to like sugarcoat things.
Right.
They're honest about the challenges, but they
Right.
still manage to be like incredibly hopeful
Okay.
and empowering, because ultimately their message is this: what? Aging. It's not about the destination.
Okay.
It's a journey.
I like that.
And we actually have a lot more control
Really.
than we realize over how that journey unfolds.
I love that aging is a journey, not a destination.
Exactly.
You know, and it's funny because when I think about, like, all the stuff we've talked about today,
Yeah.
it's clear that it's not about just, like, accepting whatever gets thrown our way.
Right.
Like, wrinkles happen, gray hairs happen.
You do.
That's just part of life.
Part of the journey.
But we can make choices,
Yeah.
like today,
Right now.
that set us up for a future where we're not just, like, getting by,
Right.
but we're actually thriving.
Exactly. That's the goal. Right.
It is, so it's about being proactive
Yeah.
instead of reactive.
100%.
We can't go back in time, but we can definitely make choices today
Right.
that affect our health, our finances, our relationships,
Absolutely.
our overall happiness.
Yeah.
It's pretty powerful when you think about it that way.
It is powerful.
Like, we get to decide how this all plays out.
We really do.
So if you had to, like, I don't know, sum up all this information, all these different aspects of, like, aging well,
Yeah.
what would you say is, like, the most important thing for people to remember?
Ooh, that's a great question.
It's a big one, right?
It is a big one.
Because we've covered so much stuff today.
we have.
So, like, if you could only pick one thing.
Okay, if I had to pick just one thing,
Yeah.
it would be this. Embrace the power of choice.
Ooh, I like that.
Because you are not just a passive bystander
Right.
in your own life.
We have a say.
Yes, exactly. You have a say, and yes, there are going to be challenges.
Of course, there always are.
And unexpected things, you know?
Yeah, life happens.
Life happens, but at the end of the day, you have the power to make choices
Okay.
that align with your values, with your goals, with your vision for the future you want.
I love that. Embrace the power of choice, because it really is about recognizing that,
What?
like, no matter how old we get, we still have a say in how our lives go.
We have agency.
Yes, that's the perfect word for it.
Right.
We have the power to shape our lives in ways that feel, meaningful.
Absolutely. So whether that's prioritizing our health, nurturing our relationships, maybe finally starting that passion project.
Or just, like, really savoring each day. right?
Exactly.
It's all about making this next chapter the best one yet.
That's what I love about this stage of life.
What's that?
It's all about reinvention.
Oh, interesting.
You know, because we have this tendency to think of retirement as like the end.
Right, like, that's it, I'm done.
Exactly. But it doesn't have to be the end.
Okay.
It can be a beginning.
Oh, I like that.
A chance to try all these new things, explore new interests. Maybe we uncover some hidden talents we didn't even know we had.
It's like that whole idea of encore careers. Have you heard of that?
Yeah.
It's so inspiring. It's those people who, like, retire from one career
Right.
and they just dive headfirst into something totally new
They find their passion.
that they're, like, actually jazzed about.
It's never too late.
It's never too late. That's so true.
Right.
So I guess what we're saying is
What's that?
aging well, it's about embracing the journey with all the good and the bad and everything in between, and just remembering that we get to decide what that journey looks like.
Well said.
Well, this has been amazing. Thank you so much for joining us on this deep dive.
It's been my pleasure.
And to our listener, we hope all this info helps you embrace your own aging journey with, a sense of optimism
Yes.
and curiosity,
Of course.
and maybe even a little dash of adventure.
Always.
This has been the Deep Dive